It's life. And I'll just be a moment. Hey, everyone, and welcome to Chef AJ Live. I'm your host, Chef AJ, and this is where I introduce you to amazing people like you who are doing great things in the world that I think you should know about. Well, we have been broadcasting live daily for almost 3 years now and have done over 1,300 shows, but never before have we had a guest where immediately and during the broadcast, have her back. We probably got over 100 emails. When is she coming back? Her name is Dr. Rubin, and she is a sexual health expert. There's apparently very few in the country. And she is going to talk to you today about things like libido, arousal, orgasm, erectile dysfunction. These are all questions that you have submitted. Please welcome her back to the show. Thank you so much. I know how busy you are, so I so appreciate you coming back, Dr. Rubin.
I am so happy to be here. I couldn't believe the unbelievable response we got. I didn't know anything about what I was getting myself into going on your show last time, and it just was absolutely incredible. So I'm so happy to be back. You are a force, Chef AJ.
Well, thank you. And, I just to prepare for the show, I watched the last episode, and there were a lot of questions in that on the feed underneath, but so many wonderful comments, which I hope you saw about you and your compassion and your knowledge. And people really appreciate this because it's not like anybody's talking about this.
But people want it. Everybody has the questions. If so many people have questions about sexual health, want their sexual health improved, want the old sexual health back, don't know why it's not working anymore, and don't know where to go to ask the questions.
Absolutely. Well, I'm 63. And I don't think I've ever been to a doctor that has ever asked me anything about my sexual health, other than maybe there's a questionnaire now and then. Are you sexually active? Or if so, which gender? Like, that's about it. Nobody's ever asked me, does it hurt? Do you like, nobody's ever asked me anything about my sexual health.
And that's my experience too. And everyone knows what I do for a living because I never stop talking about it. And so, right, it's really important. And if a doctor asks you about your sexual health, it's so fascinating. It always comes up in the vices section. Do you smoke? Do you drink? Do you do drugs? Do you have sex? Like it's some kind of a bad thing. And you're like, wait a minute, like human life happens because people have sex. So it's very confusing and we don't talk about it. And yet it is why our society even continues. And so it's this thing everyone is doing and nobody's talking about it. And everyone assumes that everybody else is having the best time ever. But so many people have issues and complaints and problems. And there's a lot of inequality when it comes to sexual health.
Absolutely. And especially so many women I hear from as they age and it becomes difficult or painful or impossible, and they feel a lot of shame and they don't realize a lot of people are in the same boat.
Yeah. And that not only just because it's quote unquote normal and happens as you age doesn't mean there's nothing we can do about it. I need contact lenses. I would be blind as a bat if I didn't have my contact lenses in. And so you could say, well, just suck it up, Rubin. It's part of aging. You're not supposed to see. If that were the case, I would not be a productive member of society. And so there is so much we can do to help with sexual health problems, whether it's libido, arousal, orgasm, or pain. There's a lot we can do for male patients. There's a lot we can do for female patients. And the problem is people don't ask the questions because they assume, or they see the doctors who aren't educated about these things and they think there's nothing to be done.
Absolutely. And so many people went back on like estradiol or Uvafem because of your show, because they were so afraid. And you explain how it's going to help in so many other areas, urinary health. So many people I heard from in their 50s, 60s, and 70s said, I was afraid to take it, but now I'm taking it. So we might even have had some improvements in these people in the last 3 months.
Yes, exactly. In the last 3 months, I bet you we've cut down on the number of urinary tract infections, the number of people getting up in the middle of the night because they have to go pee, the number of people who, feel like they can make it through an entire movie without having to go pee, and the people who are able to have relations with their partners again, which is, again, these benefits of there's very low to no risk using local vaginal hormone therapies to prevent urinary tract infections.
Speaking of getting up at night to pee, that's me. Have you heard of the Zyda control sock?
No, tell me more.
Oh my God, I'm going to get to try it, and I'm going to have them on my show, The Creator, who's in Israel. So there's a thing and I broke my back 40 years ago, and I've had a lot of problems down there urinarily, and so frequency and getting up to night and pee, and I certainly don't want incontinence. So I was going for this treatment called PTNS, percutaneous nerve stimulation, and it worked great for years. But in my new city, for whatever reason, it hurts. They're always it's not working for me. And I found out about this product through my urogynecologist. And it's approved, I believe, by Medicare, but maybe not so much for patients. They have to still pay out of pocket. It's $700, but it's basically just a sock you wear that gives you PTNS. You don't have to leave your house.
Oh, that's so good to know. And that is fabulous. And I think I knew there were companies looking at doing, nerve stimulation to help with those types of things, but I hadn't heard of any products that were out there. There's another one coming to the market where they implant it in your ankle, and it's sort of a constant thing, which is very interesting. So the technologies that are coming out are very exciting, but we got a lot of work to do on the research side of things.
Right. Well, I'll send you the information on this. And of course, when I do the show, but first I have to do it for 12 weeks and then I'll have the inventor on, but at least it's completely non-invasive. You're not poking, you're not doing any surgery. So, I mean, the worst that can happen is it doesn't work because there's really no risk to wearing a sock, in my opinion.
Absolutely. How very exciting. Yeah,
well, great. And you know what? You don't have to share slides, but sometimes the slides can just get the conversation going and we can learn a few things. Like I learned from you that I loved your thing on Twitter about nursing or patients in the ICU. That was really interesting what you talked about.
Yeah, what I want to bring up today, and can you see my slide, Chef AJ?
Perfectly.
So what I want to talk today is, I got hundreds of emails after talking with you. And for anyone who's listening and they want to sign up for our newsletter, go to rachelrubinmd.com, sign up for our weekly newsletter, follow us on social media at Dr. Rachel Rubin. I got hundreds of emails of people saying, where can I find you in this location, right? Who does this where I live? And I know some people and some people I don't. And so I want to give some resources to people out there to say, okay, how do you find someone who knows what they're talking about and what kinds of questions can you ask? And so I don't have to spend too much time showing slides, but I think what I do a little bit differently is I really try to get patients to understand their biology. When you understand your biology and how it works, then you can advocate for what you want. My orgasm isn't working. My erections aren't working. I have this problem. What is the biological basis of that problem? And what treatment strategies do we have? Now, unfortunately, this is how I learned sex ed. I don't know about you, Chef AJ, but for me, it was middle school sex ed class. It was a male gym teacher. And I remember almost nothing about that class, right? It was, you remember nothing. And so that's as much sex ed as people get, right? It's from their middle school gym teacher if they're lucky. And so we all are really uncomfortable talking about private parts, right? We don't talk about them. We often don't talk about them with our friends. We don't talk about them with our doctors. And especially if things are not going well, we think everyone else is having these wonderful sex lives and these perfect situations. And so we don't talk about things when they're bad, especially if you have friends who know each other's spouses and things like that. We never often talk about sort of our sex lives, right? And so you have to joke. If you can't joke in this world, where are we going? So no, you can't touch it. You already broke yours off, right? This idea of, what's going on with his anatomy and what's going on with her anatomy. And then sometimes you do go to the doctor, and this is what happens if you're a woman at the doctor's office, right? We act like mechanics, sort of underneath the hood there. You have no idea what we're looking at. You have no idea what's happening. And so we got to get better at really learning our own body parts. I'm a big believer in understanding sort of this comprehensive sex education. We have to talk about how mental health and relationships, we have to talk about consent and safety and body image and empowerment, right? This idea that you deserve sexual health and quality of life, no matter what you look like, no matter how much you weigh, no matter your disability, and you deserve information, education, and research, right? We're really lacking on research. And often it's a very biopsychosocial approach, right? I have to care about your biology. I have to care about your where you grew up, your cultural upbringing, how you think about all these problems. And it really takes a lot. It takes time. It really does take a lot of time. So how are we going to do this in a 10-minute doctor visit, right? How can you really help people with their sexual health and give a crap about their quality of life in a 10-minute doctor visit? Like, it doesn't work that well. So you have to see providers that genuinely care about these topics and also will spend the time getting to know you to really try to dive into how they can help. And so for me, I do 4 things, right? I deal with issues of desire, arousal, orgasm, and pain. And of course, there's a lot of overlap with all of these topics. And sometimes they're very complicated. These are not all psychological issues. There's a lot of biological issues. And so it's often kind of a puzzle piece. I joke I'm a sex detective, right? I try to figure out complex issues that people are having and really really try to put it together. And I often have to work with a team. And so I really just want to spend the next minute or two talking about what that team might look like. So we may have you see a pelvic floor physical therapist, which is someone to help with rehab, for your muscles. We may have you see a sexual medicine specialist, a urologist like me, or sometimes a gynecologist or a primary care doctor who's had extra training in sexual medicine. And we may talk about seeing a sex therapist, someone where you can talk about the psychosocial issues. So how do you find someone in your area? Well, we need more doctors and we need more training and we need more people who care about this stuff. But if you're a woman or identify as a woman and you want to find a provider, I strongly recommend to go to iswsh.org, ISSWSH.org. They have a find a provider section. It's the International Society for the Study of Women's Sexual Health. It is a wonderful organization. I'm the education chair right now, and I absolutely love all the people in this organization. If you are a man with a penis, we recommend the Sexual Medicine Society of North America. They have a find a provider section. This is a lot of urologists all over the world, actually, who work on these types of issues. If you are menopausal and you need a menopause specialist, the North American Menopause Society or menopause.org has an excellent find a provider section. I happen to be on all three of these find a provider websites, because I do see women's sexual health, men's sexual health, and I am a menopause provider as well. But these are great places to find people in your area. If you need a pelvic floor physical therapist, if you've got incontinence, pelvic pain, if you've got orgasm issues, arousal issues, there is so much musculoskeletal support that is needed to have maximal pelvic health. And so going to a website, there are quite a number of websites where you can search pelvic floor physical therapy. This is one of my a very good friend's websites, pelvicguru.com. And what's nice is they will let you categorize by women's health, men's health, and sexual health, and you can find somebody in your area. Mental health is so important for everybody, right? Your mental health is so important, and that affects your sexual health. And so if you need a sex therapist, ASECT, which is the American Association of Sexuality Educators, Counselors, and Therapists, is a wonderful organization that has a find a provider as well. Not every area in the world has an ASECT certified provider. So if you go to someplace like psychologytoday.com, this is like Yelp for therapists. You can search your location, you can search what kind of therapist you want, and you can feel like you're online dating. You can look at profiles and look at therapists' profiles and say, "Ooh, they would be a good fit for me. I really believe that they can help." So I just want you to understand that doctors are not usually trained to do this. And for any doctors or providers listening, you have to just start asking. You have, and for the patients, you have to ask your provider, because often they won't bring it up. And you have to ask questions. If you're bothered by your libido, arousal, orgasm, or pain issues, you have to bring it up, and you have to seek out a provider who is genuinely going to listen and care. We have lots of tools in our toolbox to help you. I am a big believer that you deserve this. And so please reach out. Sign up for our newsletter at rachelrubinmd.com, reach out on social media. Happy to answer all the questions. I just wanted to give people resources, because I think I must empower you to get educated, understand what's happening in your bodies, and then demand good quality care. That's really, really important.
Oh, this is so helpful. And everything you mentioned, I'm putting the links in the show notes.
Yay.
And in the chat. Well, great. Well, let's get right into the questions. There are so many. So we will start with this one. This is kind of a fun one from Elizabeth. I've recently had a significant weight loss of over 70 pounds in my mid-50s, and I'm postmenopausal. I'm experiencing increased libido, which is great. Is this because of my better body image, or could there be something physical going on as well?
The answer is yes and yes, potentially, right? If you feel good, if you're exercising, you've got endorphins and you're boosting dopamine everywhere in your brain. Dopamine is so important for sexual health. So when we treat people for low libido, we treat it with psychosocial, like therapy and dopamine boosting agents, right? If we can get dopamine, that's why date night works and vacation sex is so fun, because you can boost dopamine in your brain. So it sounds like with your new activities and all the hard work you've been doing, you've really done a great job of boosting dopamine in your brain in many different ways. There are also biological reasons to help with libido. And so we can boost dopamine dopamine through medications, through exercise, through changes in hormones. And so hormones do play a role. Dopamine boosting agents play a role. There's all sorts of ways to boost libido. And I would say I wouldn't question it. I would just enjoy the time. I would enjoy yourself and keep it going.
That's fantastic. Thanks. Oh, where did sorry, I had it pulled up. Here we go. This is from Elaine. After 2 months of using estradiol insert tabs, I still get a UTI after intercourse. What should I try next?
It's a great question. Don't stop the vaginal estrogen. Sometimes you need additional therapies. So vaginal estrogen, if you're using the tablet inserts, take about 2 to 3 months to start working. So you're still in that period where I don't think you've gotten maximal benefit. And I also want to make sure, so that's the step one. And then sometimes you need to increase therapy, meaning you may need a little topical therapy at the vulvar opening to help with some discomfort at penetration. You may need pelvic floor physical therapy if you have some tightness or pain, and you need a good exam. Sometimes the tissue is actually very androgen dependent, and you have to add a little either vaginal DHEA or topical testosterone to the area, and that can be what helps reduce urinary tract infections. The important thing to tell you is that hormones are the baseline foundation. So they may not be the only answer, but they're the starting answer, if that makes sense. And so sometimes we have to add therapies. It's also really important if you're getting urinary tract infections that you check for a culture so that they can actually know if there is bacteria growing, or are you just having pain and irritation and discomfort from sexual intercourse, which makes you feel like a UTI, or is it a real UTI or not a real UTI? Not all pain, inflammation, and irritation is infection. And so keep going, see someone who knows what they're doing, and I'm wishing you the best of luck.
When you get these, the cultures, isn't it important to do it more than 24 hours? Because I've gone in with what I thought was a UTI and they said, no, you don't have one, but they've only cultured it for 24 hours. But when I go to a different doctor and they run it for 72, I have it.
Well, there is still a lot of unknowns when it comes to culture. So some doctors will do just a dipstick, which just looks for signs of infection, but you really want them to send it out to get an actual culture. And there is some different ways to do cultures. There's different types of cultures out there. And so the answer is that science is not exactly perfect just yet. So it a little bit depends, if that makes sense.
Okay, great. And you mentioned DHA, and actually somebody named Regina sent in a question in advance, like, how do you know when you should be using estrogen versus DHA?
Gosh, if I could get DHEA in everyone's vagina as first-line therapy, I would, because the tissue is very androgen and estrogen dependent. So I love DHEA. The problem that we find, and we have some data that we're going to be presenting at the American Urologic Association about how DHEA will prevent urinary tract infections, just like vaginal estrogen. The problem is it's not always affordable and available to patients. I recommend FDA-approved products that have been studied and we know what's in them. And the FDA version of DHEA is not covered easily by every insurance company. So often I have to have a patient try vaginal estrogen. And then if they're still having symptoms or irritation, I can then write a letter to the insurance company and say, hey, they really do need this, vaginal DHEA. And sometimes that is helpful. We have a little bit of data out of Europe that does show that someone who still has symptoms on vaginal estrogen does have some improvements with DHEA. So I wish it were more affordable and available to more patients. And so again, clinically, often you get the same results with the vaginal estrogen or the DHEA, but those are some of the workarounds, if that makes sense.
But if a patient is willing to pay for it, that's
So there are coupon cards through the company, and then at Costco, actually, cash price at Costco is $85 per month. So it's not cheap, but it is at Costco. It's one of the better deals out there.
Wow, but it may be worth it to some people, especially if they can afford it. So thank you for that information. That is great. Have you ever heard of the Microgen DX testing?
Yeah, and I think it's very exciting, but it's also the problem we're having as doctors is that we have a lot of advanced testing, but not so much advanced knowledge of what to do with the data that we collect. And so I use some of those different tests in my practice when you're trying to figure out what's growing from a sort of a very microscopic PCR level, but not everything that grows is dangerous or the cause of people's symptoms. And so you have to remember the vagina is not a sterile, clean place. It's full of good bacteria. There's tons of bacteria in the vagina, and the urinary tract is also not necessarily a sterile place that has no bacteria. And so we're still trying to understand which bacteria and bugs are bad guys versus good guys versus they're just hanging out and enjoying the ride. And so that's the challenge that we faced. Again, not everything that is inflammation, irritation, and pain is infectious. And so it's really challenging to figure out exactly what to do. And I ache for the patients who are suffering, because there is so much pain out there and people are really suffering with horrible symptoms. And we don't always have the best answers and the most clear-cut answers for them.
Great, thank you. Okay, this was sent in, and guys, you got to get on my mailing list, because for doctors, you got to have them in advance. We send you an email every Sunday. You just reply to it, who it's for, chefaj.com, links in the show notes. Okay, this is from Michelle. Okay. My question is, can pathogens from gut dysbiosis get into the bladder area and cause irritation or inflammation? I'm 58, postmenopausal, and will be starting vaginal estradiol cream soon. So hopefully that will help me with the pain and discomfort in the bladder area. And I'm also working on healing my gut.
I am so excited for you that you're going to be starting some vaginal hormones. It takes about 2 to 3 months to get all the good bacteria growing and the bad bacteria to calm down. And I believe there is a lot of microbiome research that is undergoing and exciting. And I think gut microbiome research is in its infancy, and it's very hopeful. Again, it's a very similar story, right? We want the good bacteria promoted and the bad bacteria to go away, and we want the healthy microbiome. And so the only probiotic, I want to be very clear, the only probiotic that has proven to work for urinary health, in my opinion, is vaginal estrogen. And for all of you who are yelling at me that vaginal estrogen is not actually a probiotic, I mean that very jokingly, in the sense that it is the only thing to promote good lactobacilli, to get rid of bad bacteria, to prevent urinary tract infections. There are no actual probiotics out there that have been proven to do just that. And so, I welcome companies to do research and to actually prove that their products are working. But the only thing that really does make the vagina acidic and fight infection is really vaginal hormones, which is they're wonderful, underused products.
Fantastic. Thank you. This is from Jennifer. Dr. Rubin, what is your opinion on HRT with women that had endometrial cancer that was estrogen based? I had it in 2019, no chemo or radiation, just a hysterectomy, but my oncologist says I cannot go on HRT.
So I can't speak to your specific cancer and the specific issues that you have. I will tell you that as a urologist who treats men's sexual health condition, we give recommendations to men all the time of what we think may be best for their bodies, right? We as doctors are your consultants. You ask us for advice and we give you our best advice and to the best of our ability to have, with what knowledge that we have. But at the end of the day, you also have to understand that you have body autonomy and you get to do research and you get to learn about what are the risks, what are the benefits, what does the data really show, and what do I want to put into my body? You decide if you put alcohol into your body. You decide if you put drugs into your body. You decide if you put hormones into your body. And so we make the best decisions that we can with the information that we have. So there are cancers out there where there is a worry that we could promote the cancer with hormones. But there are also, the question is, what does the data actually show? What does the data, because I think for breast cancer, for example, the data showed that women who were only on estrogen who didn't have a uterus, who took estrogen, had a decreased risk of getting and dying from breast cancer. We used to treat breast cancers with high dose testosterone and even high dose estrogen. And so you have to understand this blanket, all hormones are bad and all hormone positive cancers is not actually based in that much reality. And so all cancers are not the same. All hormone positive cancers are not the same. And so again, I'm not speaking to your specific type of cancer. I can't give you the full green light that say, yes, this is totally safe for you to use. But at the end of the day, we take risks all the time. We take risks drinking alcohol. We take risks eating a hamburger and French fries. We take risks going to the grocery store during a pandemic. And so you get to decide what you put into your body. And I encourage you to do that research and ask many different people and decide what are your symptoms that you want to treat. Because sometimes if you're having this is again, back to the vaginal hormones, it's not just a little vaginal dryness that we're treating, right? The oncologists think, oh, it's just a little vaginal dryness, put some lubricant on it. But no, it's urinary tract infections, it's pain, it's frequency, it's urgency, it's leakage. And so you have to understand what really are your symptoms and what are we trying to treat.
Great, thanks. This is from Anonymous, and she says she has cancer that's in remission and not on maintenance meds. At your suggestion, meaning your last appearance on Chef AJ Live, she's taking 10 milligrams estradiol twice weekly. Can you reassure me that this is not going to put me at a higher risk for reoccurrence? I don't think you can ever.
10 micrograms. I just want to be, it's 10 micrograms.
Sorry.
No, that's okay. Yeah. But I just want to be clear because it's a lower dose than that. So 10 micrograms of vaginal estrogen. We have no data that is a home run supporting data to show that there is any harm to vaginal hormones in any way. They've looked at it over 18 years in the Nurses' Health Study. They looked at it in the Women's Health Initiative. There are many, many long-term studies that show no harm to vaginal estrogen. In fact, there was a study that just came out that showed systemic hormones didn't hurt breast cancer recurrence, and using tamoxifen, vaginal estrogen didn't affect breast cancer recurrence. But there was a little blip with people on aromatase inhibitors, a tiny blip. And even that blip was not home run evidence that vaginal hormones can create problems with recurrence. So if you are not recommended, again, you'll never get 100% certainties in this world. Your cancer could come back, but would it come back because of vaginal estrogen, right? There's no data to support that. And if you are having frequency, urgency, pain, urinary tract infections, there is a lot of risk to being on constant antibiotics. There is a lot of risk to not being able to, have a comfort down there and to have too much inflammation down there. So again, I encourage you to do what's right for your body.
Thank you. All right. This is from Diane. I've been on the twice weekly Uvafem protocol for several years, yet sometimes I feel like I need an extra dose in between. Is this common and is this allowed?
Yeah, so I've seen doses as much as 3 times a week. It's a very low dose, so I don't think 3 times a week would be harmful.
Great. Okay. Let's see.
You have such smart listeners, Chef.
Thank you.
These people are so smart and so, where do you find all these humans?
I've been doing the show 3 years and most of the guests are medical doctors. So I guess they're learning something. Thank you. This is from Delicia. I'm 65 years old, female. Why do I get terrible bladder infections when I have sex? And what can I do to stop this from happening? This is so common. I hear this all the time.
Vaginal hormones, vaginal hormones, vaginal hormones. So if you go to my website, rachelrubinmd.com, I have 2 resources. If you go under blogs, there is a video of me talking about this ad nauseum for long periods of time. And there's a blog post as well called The Magic of Hormones. And the important point is that vaginal hormones, right, create a tissue that is healthy and strong and can fight infection. Think about babies. Babies have vulvas that are red, raw, irritated. They pee their diaper all the time. They are not, you couldn't even, that is not a sexual place. That's no hormones. Then you go through puberty, you get a surge of hormones. The tissue becomes thick and healthy and lubricating, and you can have sex and do all of those things with no pain. Babies can happen. And then menopause is the opposite. You're going backwards, right? You're losing all those hormones. And over many decades, now you're in your 60s, right? You've now had, a decade and a half of no hormones down there. The tissue becomes raw and irritated and uncomfortable. And if then you try to have penetration and sex, it becomes even more uncomfortable. And that really does breed, the symptoms of urinary tract infections as well as actual urinary tract infections. And so the key here is prevention, prevention, prevention. Using vaginal hormones, just like you moisturize your face, or you put on chapstick, or you wear your seatbelt, you do it because you want to prevent problems, and you do it forever. So these vaginal hormones are local, they're safe, and what they do is prevent problems. I don't want to see you when you're miserable with a UTI and you need antibiotics. I want to prevent that problem from ever happening, because you deserve to have sex with your partner. You deserve to not be in pain when you have sex with your partner, and you deserve not to suffer for, a week afterwards, where you decide to, okay, I'm going to do my wifely duties and have my mercy sex, and then you have to suffer for a week afterwards.
Yeah, I hear from people about this. The vaginal hormones, but that has to be prescribed by a doctor. Right?
Yes, it would be nice if it were over the counter. They're working actually in England on making it over the counter, but it is a prescription. But any doctor can prescribe it, a primary care doctor, an ER doctor, a telemedicine doctor, a gynecologist. If they don't feel you could easily show them my blog post and they will prescribe it for you. These are not dangerous medications to prescribe.
Yeah, a nurse practitioner even could prescribe it.
Absolutely.
And these are not expensive like the DHEA. These are very affordable.
They are generic. The most affordable are the creams, and the tablets are usually the creams, and the tablet inserts are generic and should be covered by your insurance. That's the goal. If they are not covered by your insurance, the cash price, especially of the creams, is very inexpensive, like less than $10 a month at Mark Cuban's Cost Plus Drugs pharmacy. That's an online pharmacy that you still need a prescription, but very inexpensive medications.
Right. And one of the live viewers is saying, I was able to get the vaginal estrogen by prescription from my gynecologist, and it's working great. I can't believe the difference.
I love it. That's the best. See, this is
you've helped so many people with the last show. I've heard from them, women in their 70s that like, I was afraid to take it. Wow, what a difference.
I think it was your show. There was a 90-plus-year-old woman who emailed me, and I, wrote to her. I wrote back. It was the most beautiful email. She's like, I'm 90, I'm healthy, but my vulva hurts. And I sent her what I would recommend, and she sent it to her doctor. And as I'm hoping she's doing well, but 90, I mean, it's incredible, the reach with which you have.
Right. And the thing is even if somebody is sexually inactive, there's still reasons to take this, right?
And that's really the issue I am a sex doctor. This is not about sex. This is when I put my urology hat on and I say, this is a bladder health issue. This has nothing to do with sex, though there are sexual benefits and added benefits to using these therapies. But this is for me protecting you for when you're 90 and in the nursing home, that I don't want you to have frequency and urgency and leakage and pain while you're aging, right? That can kill you.
Absolutely. Now, this next question, I bet you could probably spend the whole hour talking about, because I'm guessing there's many different reasons, possibly even some might be psychological or emotional. I mean, I'm not diagnosing, but it's kind of complicated. It is from Linda. What can you do about lifelong painful dry sex where nothing has been found to be physically wrong, and when you're completely turned on, but sexual lubricants are uncomfortable or irritating?
Yeah. So, you really want to see a specialist when you have these types of very long-term issues. What was known 20 years ago or 30 years ago, we know much more now. And you want to see a vulvar specialist or a sexual medicine specialist who can really do a really long history to understand, what have you tried? What have you done? What is your story? What is your experience? And then a very detailed exam that can really understand, well, which part of it hurts down there? Is it all of it? Typically, it's the tissue right inside the labia minora, what we call the vulvar vestibule. Typically, that is the part of tissue that hurts for so many women upon penetration. And the fun fact of the day is that vulvar vestibule tissue is actually bladder tissue. And so as penetration happens, so many women say, oh, it hurts so bad right at penetration, but once they're in, it's fine. But the penetrative part really, really hurts. And that is typically what we call vestibulodynia, or pain in the vestibule. And the three most common reasons for pain in the vestibule is a hormone problem, not enough estrogen and testosterone to the tissue, a muscle problem, like the pelvic floor muscles are very tight and tender, or you were born with too many nerve endings in the tissue, or what we call neuroproliferation, too many nerve endings. And sometimes that requires a surgical correction. It's rare, but we do a handful of surgeries a year on this problem, and it can be life-saving. I had a patient just email me over the weekend. She couldn't tolerate a finger finger, let alone an exam, let alone consummate her marriage with her husband. And she was born with too many nerve endings. We did a surgery, and not only is she pregnant, but she sent me a picture that she's pregnant with twins, which is like so wild and crazy. So there are solutions to these types of issues.
That is great. Okay, here's a question. Oopsie, sorry, the name is always at the bottom, Lynn. Does Dr. Rubin know anything about the use of hyaluronic acid vaginal inserts to treat pain during intercourse? And is it effective? Could it be dangerous? This is a description sent by a company that sells it over the counter with the brand name Reverie. Is a non-hormonal, easy to use vaginal insert. We have discovered that hyaluronic acid, HA, hydrates and renews the vaginal tissues in the form of a hormone-free, easy to use vaginal insert found naturally throughout the body. Each molecule of hyaluronic acid attracts and retains up to 1,000 times its weight in moisture, healing thinning and damaged skin and keeping you comfortable from wherever life brings.
Hyaluronic acid does have some research behind it, especially in the breast cancer population. It's a very nice, what we call vaginal moisturizer or lubricant, right? It really helps to help with the discomfort. If you think of like rubbing sandpaper against something, right? If you moisturize it and thicken it, it doesn't hurt as bad. So it is a wonderful Band-Aid for pain with intercourse. And, again, I have no problems with patients using it. There is data, especially with the breast cancer patients, and you should use moisturizers and lubricants if you're having discomfort. I think the issue is that many women who would benefit from vaginal hormones to fix the tissue, to heal the tissue, are not using it because they're terrified of data that doesn't exist that shows harm, right? They're terrified. And so that's really what we're trying to educate women on, is to say, not go ahead, use your moisturizers and lubricants, but if you are having urinary tract infections and significant bladder symptoms and bladder issues, the hyaluronic acid has not been shown to prevent those problems. And so it's a wonderful Band-Aid, especially when it comes to day-to-day comfort as well as sexual intercourse pain. But if you're really trying to reverse the symptoms of the bladder issues and the urinary tract infections, often we can fix that problem with vaginal hormones. And many women who would be good candidates for it are afraid of using it because of just bad information that's out there.
Thank you. And speaking of urinary tract infections, this question's from Sandra. I am on HRT, but still get frequent bladder infections not related to sexual intercourse. My doctor wants to put me on antibiotics for 6 months for chronic UTIs. Is this safe, or will I become antibiotic resistant?
It's a great question. And so the question is what I would have for her is what her HRT or hormone replacement therapy regimen really is. Because I find that women who are on patches or pellets or creams or gels often still need vaginal hormones, and often the whole body hormones, for whatever reason, there is a subset of women where it's not enough to prevent urinary tract infections. So I would recommend that she be on local therapy as well as part of her regimen to prevent her bladder infections. Now, if she says to me she's on all of that and she's still getting infections, certainly there are treatments that may include antibiotics. I can't speak to her specific issue, but yeah, antibiotic resistance is a concern. And so the goal is always prevention, is what can we do to prevent the problem?
When you say local, you mean like a...
I apologize. Local is like the vaginal inserts, the vaginal tablet inserts, or the creams, or the vaginal DHEA is going to be really, they make a ring as well that go locally inside the vagina.
Right. Rather than like taking a pill. Exactly.
Right.
Okay, perfect. Thanks. Just to clarify. So this is from Regina, and she says, why does the packaging on pessaries warn that it can cause cancer? And honestly, maybe explain what that is, because I don't know what a pessary is.
Well, so I don't know. So a pessary, it's a great question. A pessary is, she may be asking a different question. So a pessary is not a hormonal treatment. Classically, a pessary is something like a disc that goes in the vagina that holds up prolapse. So if your vagina is prolapsing or falling down a little bit, which can happen after childbirth, there are things called pessaries that hold everything up. Now in Europe, they make a ring that has vaginal estrogen in it that in Europe they call a pessary often. And that may be what she's asking, is that vaginal hormone products have labeling on them that says will cause stroke, blood clots, cancer, heart disease, all sorts of problems. None of that is true, actually. All of that is based on false data for when you take a birth control pill style hormone therapy. And even that data is not very true. And so the labeling is actually quite wrong. It's similar to, there are these blanket labels that go on all products, even though all products are different from each other with different amounts of research on them. And so it can be very scary to be a patient to say, oh, I'm using this local therapy and it says it's going to cause stroke, blood clots, heart attacks, all these things. And none of that is true. So it's really important that you learn the data and learn that the box labeling from the FDA is actually quite wrong. And if the FDA is listening, please call me. Let's talk about this. Let's change the labeling, because we're actually hurting women by having that labeling on there. We're killing women, in fact, by having that labeling on there, because it's not true. And women are dying of urinary tract infections.
Thank you. Sylvia wants to know, do you take patients remotely?
So we are, gosh, we're so busy, and thank you all for coming in. We love when people fly in to see us. We love when we do remote visit. We do some remote consultative things of giving advice and listening to stories. And we certainly are trying to advance our telemedicine capabilities. So if we do feel that we can be helpful, please call the office and we can certainly let you know how it works and how we've been trying to take care of people. And I'd love to grow my team this year and to see if we can help more people. It turns out a lot of people need help. And every time I go on Chef AJ, I find out the more and more people who need help. So I probably shouldn't keep coming on. Otherwise,
no, don't punish me. How did I find you? I know it was from a previous doctor that was.
Yeah, it was from Marcia Seidman connected us. She's a primary care doc in the DC area.
Well, I should probably send her more vinegar then. I should thank her. What a treasure you are. What a find. Thank you. Okay. Here we go. This is a really interesting question, I think. They're all interesting, but this is from Sharon. Is it okay to be fit, healthy, not take any drugs, but still be totally disinterested in sex?
Yeah, it's totally normal, quote unquote. The question is, are you bothered by it? If you have no interest in sex, and it's not bothering you and you're living your best life, you continue to live your best life. If you used to be a sexual person who loves sex and wants sex, and or you weren't and you still want those things, if you're bothered by it, there are many solutions that we can try. We have a toolbox that we can use, and that ranges from things like education in sex therapy to hormonal medications and non-hormonal medications. If you can understand that antidepressants can cause sexual side effects, low libido, delayed orgasm, could there be medications that could boost sexual function? Of course, and there are. We have medications that can boost sexual function, and they work. Not in everybody, but they work in about 60% of people who take them. So what's important is that if it's your bother, I don't treat your unless your partner is my patient, I'm not treating your partner who's bothered that you don't want sex. I treat you if you're bothered that you don't want sex. Does that make sense?
Absolutely. It's only a problem if it's a problem for you. Okay, this is from Lynn. Dr. Rubin, every time I tried BHRT creams, I gained weight. Is this a side effect of vaginal estradiol? And do you recommend estradiol and DHA? Maybe she means DHEA, because DHA is, I think, something else, or only one of those for vaginal atrophy?
Yeah, either or is typically, you don't typically need both, although it's never been studied. It would be interesting. And so the weight gain is an interesting one. We tend not to think of most HRTs as weight gain, almost weight neutral. Menopause in general can come with a lot of weight gain and changes in metabolism. Everyone is different. Now, certain formulations of hormones, some people are very sensitive to progesterone or different progestin products. Most people do fine with them, but you do see occasional issues with that. And so this is why hormones are not a one size fits all. It is not something that everyone should get the exact same regimen or the exact same thing. We do not typically see any weight gain issues with local vaginal hormone products. But again, everyone's sensitivities and everyone is a little bit different. And so you have to see a provider who genuinely understands and can tinker and work with you. I saw a patient just yesterday who was so frustrated. I saw two patients yesterday, one where everything I threw at her was working and working amazing. And she was like the happiest person I ever saw in my life. It was wild. Everything. She got all these things and everything worked and she was so happy. It was only like a month later. And then I saw another patient where nothing we were giving her was working. And she was so frustrated, but we were still trying to tinker to find something that made sense for her. And so you have to see someone who's going to be patient and really work with you, because there's lots of different products. There's lots of different modalities. So just because, like, for I have a lot of patients who say, oh, vaginal estrogen cream didn't work for me. It burned, it irritated. And the answer is, okay, let's try a different form of vaginal hormones. It's not that the hormone itself was bad, but the cream was irritating and the cream was not the right thing for you.
You just seem like you're such an amazing doctor. Did you always want to be a doctor?
I never thought I was smart enough to be a doctor. I still don't think I'm smart enough to be a doctor. I was in medical school. I was lucky where I went to medical school. They had you could sign up early for their where I went to college. They had a thing you could sign up early for their medical school if you had good enough grades, and I had good enough grades. And so I said, oh, sure, let me try to apply for this. And so I was admitted to medical school before I even had that moment of like, oh, I'm smart enough to be a doctor. So I've always been a very hard worker, and I've always been passionate about asking people, genuinely caring about other people and being so curious about other people's emotions, feelings, thoughts. I don't know. I think I have an emotional intelligence that I thought everybody had, but I don't think everybody has. And it's just, but I can't do it in 10 minutes. I can't do it. I like spending time with people and developing that personal connection where it's so fun. I get patients, they say, oh my gosh, your daughter's in college, she's now, 18. How's it going? It's just so fun to know people and to really grow old with them, I guess.
Wow. I almost want to fly to, were you Washington, D.C., Maryland?
Yeah.
Oh my God. Thank you. This is from Sam. What does the doctor suggest for someone who has amenorrhea due to an extreme low weight for a period of time, but it never came back? And I don't know if she means the period or the weight. It may be too late over 10 years as an early menopause thing, but is there a way to test or something to try? Not sure where to start.
Yeah, you must see a doctor who knows about hormones. It's so important because it's menopause, right? Your body, the not having enough weight on you will stop your periods, and you are at risk for significant osteoporosis and bone density problems and health problems and cardiovascular problems. And so it's okay to be on hormones in your shoes if that's what you need. And so I would, you need blood testing, hormone testing, and you need someone who's going to work with you to tinker and get the right regimen that makes sense for you. It's important to get nutrition involved, and really, if mental health is an important component, it's important there. But the answer is there's many things from what we call a biopsychosocial point of view that we could do to help, and you deserve, good health and quality of life too.
Thank you. Okay, here is, and it's kind of an they're all interesting, but this one from Barbara says, why do some menopausal women have none of these problems and others do? Is it because some menopausal women have a little bit of estrogen, just enough not to have bladder problems, for example?
It's the $1 million question, and we don't fully know. And the theories, there are a couple theories, right? Some people have very sensitive receptors. So a small amount of hormone can do a really good job of making people feel good. Some people may have more hormone than others. Maybe fat tissue creates some more estrogen that happens, or adrenal glands create some hormones as well that maybe the ovaries are not producing. And so there's probably variations in people's biology, which is why not everybody has the same symptoms and not everyone needs exactly the same treatments.
Thanks. Cheryl says, what about smokers using hormones locally? I'm on a permanent Foley due to MS. It is through a suprapubic, and I'm fighting constant UTIs. I was told no antibiotics unless I had visible blood. So I'm in constant pain and agony with untreated UTI that smells horrendously bad. I'm 60, well past menopause. I'm assuming she must be a smoker, because why would she be asking, right?
You absolutely need vaginal hormones. Yesterday, a month ago, 6 years ago, vaginal hormones, no risk with, I encourage you to quit smoking, but no risk with smoking, no risk if you've had a history of blood clots, no risk if you have a family history of cancer or blood clots. Vaginal hormones are very important for you to keep your tissue strong and healthy and to fight as much infection as possible because of that chronic like indwelling catheter that you have, you're going to be set up to get worse symptoms and worse infections. Use the hormones, and in about 2 to 3 months, get yourself in to see someone called a pelvic floor physical therapist. They will change your world and change your life. And I ache for you, and I pray that you can find relief, because it does sound horrible.
Yeah, thank you. Here's one from Denise. When I had a vaginal exam recently, the gynecologist said there were 2 small areas looking a little white, and she prescribed vaginal estrogen cream for twice a week. What are those spots, and will they go away? Also, she said to put the cream on the labia as well. Do you recommend this?
I recommend putting at least 1 gram of the cream vaginally twice a week. And then you can also rub some on the labia, inside the labia minora. If the white spots do not go away, they likely need a biopsy. And the doctor would have to want to rule out something called lichen sclerosis, which can happen in menopause, which is an inflammatory condition of the vulva and does require vaginal hormones and steroids to help prevent worsening of the inflammation. And if it is lichen sclerosis, tiny percentage of people can develop vulvar cancer. So you want to really make sure it's well treated, and you get you do need steroids on the tissue. So you want to make sure those white spots go away, and if not, get them biopsied.
Yeah. You say different body parts or different areas of the vaginal area. Some people don't even know what they're called or where they are. And that is the God honest truth.
I know it. We're working on that.
You tell them to put it there and they're like, where is it?
This is why the New York Times wrote a full page article about, we give women a mirror. Every woman in our office gets a mirror, and we teach them their body parts as we're going through the exam. This is your labia majora. This is your labia minora. This is your clitoris. This is your vulvar vestibule. This is the urethra, the tube you pee through. And everyone gets to see. So that way, when we have treatments, we say, this is where you put the cream, and this is where this goes. And it's so empowering and incredible for patients.
Absolutely. Just one of the viewers were saying that she loved how last time you talked about pelvic health and sexual health and stress.
Absolutely. No, it's very important.
Yeah, so we got to reduce that stress. Let's see if there's any more questions. A lot of people apparently, I had never even heard of interstitial cystitis before, just really right before you came on the show. But apparently a lot of people have it, know people that have it and suffer from it. And it doesn't seem like much progress is being made for that terrible disease.
It's getting a good diagnosis. There's a lot of very ungood diagnoses out there of interstitial cystitis, where it's probably a vulvar condition, or a spine condition, or an endometriosis condition, and people are getting incorrectly, I think, diagnosed as interstitial cystitis because they feel it in their urinary tract, and that may not always be what's happening.
Yeah, somebody's saying they actually lost their bladder to that. And that's just horrible,
It is horrible. It is a horrible condition.
Is this a disease that you treat a lot or see a lot in your practice?
We do see a lot of bladder pain conditions in our practice, and we look at them from, trying to understand what's tissue issues, hormonal issues, musculoskeletal issues, and, nerve issues, and trying to help people as much as possible.
What's the most common thing you see?
I see a big variety. I see a lot of erectile dysfunction. I see a lot of menopause. I see a lot of pelvic pain. Those are kind of the big 3.
Actually, now that I think of it, because most of my audience is women, and people are always free. We had no questions on erectile dysfunction. Maybe you want to just talk about it just real briefly, because I know you have to go soon.
Absolutely. erections, the most important thing about erectile dysfunction is every decade you get older, 50% of 50-year-old men have erectile dysfunction, 60% of 60-year-olds. It's one of those things that's normal, quote unquote, but it can also be a sign of cardiovascular problems. And so if you are not getting good erections, there is a chance that the blood, that you're clogging up the arteries to your penis, which in, 5-10 years down the road, you could clog the arteries to your heart, because the arteries to the penis are much smaller than the arteries to the heart. So it's really important that you eat well and exercise and live, we love plant-based diets and things like that, because cardiac health is actually really important for penis health. And the same for clitoris too, probably. We just don't talk about clitoris health very often. And so if you do have a partner that's suffering from erectile dysfunction, we've got lots of treatments that help, but it's also really important to work on the lifestyle issues and to realize this may be a larger sign of more issues going on with your health. And you may want to see a cardiologist and make sure you follow up with that primary care provider.
Dr. Terry Mason, who is like a chief medical officer for Cook County for a while, as a urologist, been on the show, always talked about erectile dysfunction being the canary in the coal mine. And that if you have cardiovascular disease anywhere, you have cardiovascular disease everywhere. So thank you for saying that. Well, you are a treasure, and I hope you will consider coming back quarterly because we love having you on. You're just wonderful. Thank you so much, Dr. Rubin.
Thanks for having me, everybody. I appreciate it. And
My pleasure.
Sign up for our newsletter at rachelrubinmd.com. Look forward to seeing you all.
They will. Take care. And thanks all of you for watching another episode of Chef AJ Live. Please come back in 1 hour for the doctor.